So I'm Sasha Waterfield, and for my capstone research project, I researched vaccine hesitancy. So the issue of vaccine hesitancy is impacting people not only here in the United States, but all over the world. And this issue stems from people choosing not to vaccinate themselves or their children. And choosing not to vaccinate creates an issue because there are groups of immunosuppressed people, such as those with AIDS and cancer, who are not able to receive vaccinations because of their immunosuppression. And when the healthy populations are deciding to not be vaccinated, that puts themselves at risk and also the immunosuppressed populations because it reduces and could even eliminate herd immunity. And herd immunity is where there's enough of the population vaccinated that an outbreak is less likely to occur. So vaccines have been proven to be life-saving around the world for years, and they're even regarded as one of the most effective and cost-effective interventions for illness and disease prevention. So when individuals are choosing not to be vaccinated or choosing not to vaccinate their children, it makes the professionals wonder why they're making this decision. And a lot of these individuals are making the decision off of a publication that came out in 1995 from a British doctor by the name of Andrew Wakefield. In his article, he stated that there was a link between vaccinations and children acquiring autism. He stated that the MMR vaccine, the measles, mumps, and rubella vaccine, caused autism. So as soon as this article came out, researchers came to him and asked him to see his data, see who his participants were, and just see where he found this correlation. And when the researchers were looking at it, they found out that none of his data was accurate and that it had all been falsified and should be disregarded. So havoc had just started all over the world because lawsuits were being filed from families that had vaccinated their children because they were afraid that their children were going to develop autism. Other parents who hadn't vaccinated their children yet were still afraid to vaccinate their children because they didn't want them to acquire autism. So Dr. Wakefield was stripped of his license and was no longer able to practice because he produced this fraudulent information. And even though that was 20 years ago and it has been proven to be false data, the World Health Organization still estimates that there are 20 million people that are not vaccinated or under-vaccinated. And this just creates an issue at the global level because diseases that were once eradicated in countries are now coming back and causing destruction, and it's being spread all over. One case particular I found was a family was traveling from Washington to Hawaii, and when the children landed in Hawaii, they were showing signs and symptoms of the measles, and turns out they had measles. So everyone that was aboard the flight had to be tested to see if they had picked up the measles disease. So that just goes to show that as people travel, so do diseases. And at the local level, a few years back in Disney World, there was an outbreak of measles at Disney World in California. So from that outbreak, 2 cases of measles showed up in Charlotte and were linked to that outbreak. And I found that information out during one of my interviews that I conducted with Dr. Smith, who is an epidemiologist for the Mecklenburg County Health Department and also an adjunct professor at Queens. We also discussed the flu while I interviewed Dr. Smith, and she stated that 2 schools in Charlotte recently had to close because a great amount of the population at this school had contracted the flu. And this was shocking to me because the flu, like measles, mumps, rubella, there's a vaccination for. And although the flu vaccine is not 100% effective in preventing the flu, it can greatly reduce the symptoms if they contract another strand of the flu. So that just went to show me that by individuals choosing not to vaccinate, whether it be measles, mumps, rubella, or even the flu, that impacts so many other individuals. It impacts other individuals' education, and those are things that wouldn't have to happen if people chose to be vaccinated. So globally, in 2019, there have been 15 states with confirmed cases of measles. And honestly, this is mind-blowing to me because measles were once eradicated in the United States. There's a case in New York State specifically that has been getting a lot of publicity because it was a child who was unvaccinated, and he traveled to Israel, and Israel is having a huge measles outbreak right now, and also the Ukraine. And when the individual traveled back to New York State from Israel, he spread the measles. And there have been 214 confirmed cases of measles now in Brooklyn and Queens. And these cases are mainly with members in the Orthodox Jewish community because these are the members that are deciding not to be vaccinated, and they're also the ones that are traveling to Israel where the outbreak is occurring. So the outbreak has become so widespread that there was a ban for people under the age of 18 in public places if they were unvaccinated. And I had never heard of that in my life, but the outbreak has been so bad that they had to do this to protect the rest of the population. In California in 2019, there have been 16 cases of measles. So that's an increase from previous years. So it goes to show that people are still not being vaccinated. And this is creating an issue as well because now in some states, physicians' offices are choosing that if you are not vaccinated, they may not see you or they may not treat you. So this is creating an issue because now these unvaccinated children have nowhere to be treated for regular illnesses. And so they're looking for doctors who will treat them. And when there are doctors that will treat them, then this whole community of people that are not vaccinated are put together to be treated for other things, and then the herd immunity is gone, and then these immunosuppressed people are put at risk. The World Health Organization every year puts out a list of the top 10 health threats, and on the list in 2019 was vaccine hesitancy. And that was mind-blowing to me because things like air pollution and antimicrobial resistance were on the list as well. And vaccine hesitancy shouldn't even be on the list because people should be choosing to vaccinate. It's a controllable. And there are two main players that can help address the issue of vaccine hesitancy. And the first is healthcare professionals. Healthcare professionals need to be doing a better job of educating the public on the facts of vaccinations, on the facts of how life-saving they are, and telling them and disproving any rumors that they might hear. But healthcare professionals themselves need to be receiving the proper vaccinations. Through my research, I found that in Ethiopia, some healthcare workers don't receive the hepatitis B vaccine. And this is major because healthcare professionals are put at risk daily by body fluids. That's how hepatitis B is spread. So while healthcare professionals need to do a better job educating the public, they also need to make sure that they're practicing what they're preaching. The media also plays a key role in helping educate the public. Many individuals are swayed by information that they hear and see on the media, whether it's from uncredentialed sources or not, and they just need to start telling them reliable information and helping parents make the most informed choices. But parents and just individuals who may not even have children, they need to ask their physicians these questions and not look to the media, not look to Instagram, Snapchat, and things like that we look at these days. Through my research, I found that there are also physicians who are taking another route to help parents vaccinate their children. So there's one doctor in particular from Lynchburg, Virginia. Her name is Dr. Mumper, and she has created her own timeline to give vaccinations. So the CDC has a set timeline that they want children to be vaccinated on. However, Dr. Mumper claims that she has created a timeline that has reduced autism occurring in all of her patients. So this is a relatively new thing that she's been doing, so more research definitely needs to be done, but I think it's something interesting because although she has altered the CDC's recommended schedule, she has convinced more parents to vaccinate their children. So it's kind of a win-win. Another thing that I learned while talking with the second person I interviewed, Dr. Mary McEwen, who is an intensive care pediatric doctor, she told me that many of her patients' parents are deciding not to give their children the flu vaccine, and they are just upping their doses of vitamin D because they believe that that does just as much as the flu vaccine does. When I discussed this with Dr. Smith, epidemiologist from Mecklenburg County, she insisted that everyone should receive the flu vaccines because that's the most effective way to prevent getting the flu. So that's another thing that some more research could be done, and maybe vitamin D could be helpful. So just some key takeaways that I found is that additional studies need to be done to provide more evidence that vaccinations are safe and they are effective. So more people are making the decision to be vaccinated. The public needs to be better educated regarding vaccinations. And I also think that there need to be stricter laws put in place regarding vaccinations, not only on the local level, but on the global level. I think individuals that travel into the United States need to receive certain vaccinations in order to come here. So for traveling abroad, for instance, I'm going to Denmark in May. So there were vaccinations that were recommended for me to get, however, none were required. But I think to come into the United States, things such as the measles, mumps, and rubella vaccine should be required so that an outbreak doesn't occur because of an individual traveling here for vacation, per se. But on the local level, stricter laws need to be put in place because as of right now, just focusing on North Carolina, there are medical and religious exemptions available for vaccinations. So for a medical exemption from vaccinations to attend public school, a note has to be provided from the doctor. However, for a religious exemption, the only thing that has to be done is a note stating the person's name who would like to be exempt and their date of birth, and that is considered acceptable. So anti-vaxxer parents could easily stroke a note saying that it's against their religious beliefs, and then they're allowed to attend public school. And that's an issue because children are already at an increased risk for contracting illnesses and diseases, and allowing non-vaccinated children to come into the mix could really cause a huge outbreak. Another takeaway is just to vaccinate yourself and your children. There's already been so much evidence done, and I do think that more should be done to convince those who aren't convinced. But think about your children and think about yourself. One article that I read was a young woman with autism, and she stated that it's really heartbreaking when she reads that people don't want to vaccinate their children because it might cause autism, because to her that's saying you'd rather your child die from rubella, her mumps, her measles, than for them to have autism. Autism isn't the end of the world. They can still function, and be a great, productive citizen and person. So I think everyone should consider what that young woman said. Last tidbit is the World Health Organization designated the last week of April to be Immunization Week. So this aims to promote the use of vaccines to protect people of all ages against all diseases. So go out this last week of April and try to help educate people on vaccinations and how much they can help improve lives and save lives. So